A scathing AG probe into emergency departments found wait times are up and closures are far more common under the Ford government. That's primarily driven by the province's inability to retain staff, and the temporary fix comes at a huge cost. The Mammoth report blames the government's failure to maintain hospital staffing levels for the more than 200 temporary emergency department closures in the past year, impacting 23 hospitals primarily located in rural or remote areas. These closures were very rare before 2019.
The biggest concerns there with regards to the closures were the nurses.
It has forced hospitals to hire agency nurses at significantly higher hourly rates than permanent staff. Agency nurses could get paid more than $75 an hour, compared with $35 to $50 an hour for nurses employed by a hospital. One hospital spent about $8 million on agency nurses in the past year, compared with $2.4 million the year before. Do you think this is a good use of public money?
I think that we cannot take tools away from our hospital partners to ensure that they have the capacity they need to provide the service in community.
This is all about them diverting more of our public health care dollars into their private shareholder friends' pockets.
The result, growing calls for legislation capping the amount private agencies can charge to hospitals.
So we're looking at many different pathways. We do not want to limit hospitals and operators.
The AG report suggesting the money for agency nurses be reallocated to better compensate public nurses. Should the government be paying nurses more to retain them then?
When we look at comparators of other Canadian jurisdictions, Ontario is very well placed in terms of our compensation.
Well, if that was true, why are nurses leaving our healthcare system at such an extraordinary rate?
The AG also found soaring emergency department wait times are the direct result of the shortage of family doctors. 1 in 5 patients visiting hospitals chose to visit the emergency department because it was the only immediate option available. The direct cost of an emergency department visit was approximately $165 per visit, almost 3 times higher than the cost of alternative options like primary care. Despite the AG saying multiple times that the government has no strategy to tackle these major issues, the health minister insists that they do. Particularly, she says huge investments have been made to both train and hire new nurses. For City News, I'm Yazdani.